Most times when children have TB like that, they get it from an adult living in that around them. Now, if that happens, that is why for a long time, anybody that have TB, the children, more especially, now everybody, the children are supposed to be on TB preventive therapy, and that is going to be isoniazid for 6 months. But we have shorter regimen now, the 3HR, that's 3 months of isoniazid and rifampicin, and we are now having a shorter one now. They call it 3HP, which is 3 months of isoniazid and rifampicin. So there are different drugs. When you get to the facility, they tell you which one, but they are preventive therapy for those, and that is talking about the prevention. For those who have TB person in their house, then they should take preventive therapy, because there is a progression from latent TB to active TB. Active TB is when you start showing the signs. Latent TB, you have the TB. Most Nigerians have latent TB. Most of us have latent TB. We take BCG early. That is one of the prevention they give children. First 72 hours of death. Yes, that vaccine does not prevent the child from having TB. It reduces TB complications like miliary TB, TB meningitis. It's reducing the opportunity for complications, but it's not preventing the child totally from TB. Yes. So globally, there are many research going on to get vaccines for TB, but because TB is a stubborn disease, TB is an aerobe, obligate aerobe, but it wants to get oxygen. He just wants to survive. It's not actually aiming to harm us, the Mycobacterium tuberculosis. But we have different species of Mycobacterium tuberculosis. We have Mycobacterium africanum, Mycobacterium macropti, Mycobacterium this one in bovine TB, bovis, Mycobacterium bovis. So we have different types of the Mycobacterium species, but the one that is of most importance is the Mycobacterium tuberculosis, and there are a lot of research going on for the vaccine, TB vaccine. But to this point, globally, what we have been able to do is to get TB preventive therapy to delay or eliminate the progression from latent TB to active TB.
So you made mention of TB of the skin. Is there any prominent symptom when it comes to TB of the skin?
You just see it comes like a ulcer. It comes like a ulcer. You just see the generation. It may be like a whitlow.
Okay.
So like a whitlow, you may see it. TB attacks any part of the body. But for somebody clinically, if we see anyone that have TB that is extrapulmonary TB means TB that is not in the lungs or in the pleural cavity. In that way, then the person have extrapulmonary TB. One of the major driver of extrapulmonary TB is immunosuppression. So maybe the person have diabetes, the person have HIV, the person have hepatitis, and all those things reduce the immunity, and it allows the granuloma to break open and go. That will be more medical. So don't worry, don't worry about that. But TB affects every part of the body, but it's more prominent in the lung. So those who have extrapulmonary are more likely to be someone with immunosuppression condition. Thank you.
Thank you so much.